Hi, my name's Manoj Krishna, and today I'm going to tell you a story about a lady who presented with a 40-year history of low back pain. And current thinking is that patients with that duration of symptoms simply don't do well from surgery. Her MRI scan here shows that at L5S1, as can be seen in the arrow, there's a really collapsed disc, and the disc above at L45 was completely normal. Clinically, she's tender around the L5S1 segment and had all the features of mechanical back pain. We treated her with a posterior lumbar interbody fusion where we take out the disc, put a cage in the disc space, pack it with bone, and then, as you can see here on this lateral x-ray, and put some screws and rods in the spine to support it. Here's Sarah telling her own story. Afternoon, Sarah.
Good afternoon.
So let's start by, you're 61 years old.
I am, yes.
And tell me a story about your back pain, when it started and, what's it been like for all those years?
Well, it started just after we had my first son, and he was 6 months old, and I had a slip disc.
How old were you then?
I was 22.
So
just
like
22.
It's almost 40 years ago your
Yes,
pain started.
It is, yes.
Wow, okay.
Yeah, yeah.
So tell me a story of what it was like for the last 40 years to live with your back pain.
Very uncertain, very uncertain. I never knew whether my back was going to let me down. I had to manage different levels of pain, different types of pain. I couldn't predict about going on holiday or doing exercise or all the things that you expect to do when you're young and fit and healthy. I gradually had to give up things like cycling and gardening. Going to the theatre was difficult. All these things.
Because sitting was painful.
Because sitting was painful, yes, yes.
And what treatment did you have in those 40 years?
At first I started with fairly conservative treatments, so painkillers. And then I tried acupuncture and yoga. And I've been doing Pilates for 10 years. And I think if I hadn't done Pilates, my back would really have been a lot worse.
Yeah.
So Pilates has been the main treatment that has been fantastic.
And you've also been you're a carer, so that's been quite challenging with your back pain.
It certainly has, yes. It's meant that I've been more tired, perhaps less patient occasionally. We have 2 family members who I care for, and that's been quite a challenge. Both have mental health problems.
Okay. So now, talk me through your surgery. You've had some an interbody fusion at L5S1 because the scan just showed a single level degenerate disc, and that was 6 weeks ago.
That was about 6 weeks ago, yes.
Okay, so talk me through the surgery, your anxieties leading up to it perhaps,
Right.
and then your experience afterwards.
Well, I think my anxieties were mainly about how I would feel when I got home. I didn't have any anxiety about the surgery at all. I felt complete trust in yourself and the team and my physio, who I knew would look after all the exercises I had to do. But it was more my energy levels and how much I would be able to do when I got home,
Okay.
and how long that would take to recover.
Okay, so talk us through the surgery. You got admitted on the day of surgery.
I came in on the day of surgery, which was a Friday. I had about an hour's preparation, and then I walked down to the theatre and met the anaesthetist and a quick chat, and then I went to sleep and woke up back in my bed and realised that my back felt totally different.
Wow, that quickly?
That quickly, yes.
So you were in hospital perhaps 2 days?
I was in hospital 2 nights,
Yes.
and then I went home on the Sunday morning.
Okay. And how have you been since then? You're 6 weeks now.
6 weeks, gradual, steady progress, and nearly pain-free now.
You know, that's astonishing, even to me, that you've had pain for 39 years and it's virtually gone so quickly, just 6
Yes.
weeks from surgery.
It's lovely. It's lovely. It's like being a new woman.
Yeah, amazing. And you're just taking the odd Nurofen.
That's right, yes, yes.
Okay, all right. Thank you very much, Sarah.
Thank you.